Jones. Wilkin. King. Espinoza.
Item two is approval of minutes. Don't believe activity meeting is a motion to approve. I'll wait for a second. Roll call.
Wilkin.
Yes.
Wade.
Yes.
Rogers. Espinoza.
Yes.
And McNally.
Let's go to, item three, approval of agenda items. We have items A through M for approval. Is there a motion to approve A through M? Motion by Williams, second.
Second?
Second by Evans. Any questions? Any questions? Okay, with that, there's a motion second, roll call.
McNally.
Yes.
Rogers. Wilkin.
Yes.
Espinoza. Reese. Wade.
Yes.
With that, we'll go to presentations and, item four. So, for the record, we have three presentations. We have executive sessions, so we'll have to take us over. So with that, we'll start with item A.
Just, all you gotta do is that, or you can hit enter.
Okay.
And it'll advance.
Okay.
And these are ready to go. Yep.
Okay.
Good morning. My name is Natalie Kingston, and I'm a community health educator too with the department. And I have the privilege of working with our community health worker team. And we are going to start things off and just give you a little bit of an idea about the work that we do across Douglas County.
Hi, my name is Alejandra Pacheco Navarro. I'm one of our 4 community health workers here at the department. So something big that we do is in early COVID, we started a community resource document that we do share among the whole department and with our communities that we do serve. So in this community resource, we have resources like adult education, benefits, child and youth services, dental clinics, and food pantries, and a bunch of other community resources that we do share. Where are we located? One of our satellite locations is at Catholic Charities Juan Diego Center. I am housed there full time. And one of our other community health workers, Delia, she is also housed there twice a week. The community that we primarily focus with and work with is the Spanish-speaking Hispanic community. So some of the top needs that we see here at our location is rent and utility assistance, food pantry, and WIC. Another location that we staff is at our Midtown WIC. This is one of our new satellite locations. We just started staffing. Delia is housed here twice a week. And some of the top needs she sees is food pantry, menstrual products, rent and utility assistance, and transportation. So aside from being staffed here at the Midtown WIC, Delia also does the outreach for WIC. So in 2025, she has talked to a little bit over 400 families about our WIC program. And she also works with our Whispering Roots collaborative, and she has provided over 200 food produce boxes to our WIC families. She also does community presentations, which she has done 4 of them this year so far. one of our health initiatives that we do as community health workers is Project Newlands, and I have the privilege that I get to take on the lead for Project Newlands, which is just our youth mental health program, which we kind of strive to destigmatize what mental health is and kind of give our youth the tools necessary to take care of their mental health. So some of our target populations we have worked with over the years is North Omaha, South Omaha, the LGBTQ plus community, the Native American community, and this upcoming summer 2026, we'll be working with the refugee immigrant community. Some of our statistics for this past summer is in 2025, 83.6% of our participants indicated that they were likely or very likely to participate in our activities again.
Good morning, my name is Brido, and here I'm going to share a couple more satellite locations that we are housing. Here in Canyon Home Care, Lulu is housing there once a week, and she provides Medicaid and SNAP application assistant, utility assistant, and all DHHS update and renewal applications. She also provides language assistance to those who in need and refer people to the immigration services, food pantry, and provide menstrual products as well here in this location. Myself is housing at Korean Society of Nebraska once a week. I'm also do Medicaid and SNAP application assistant, and I do blood pressure screening over there to people who want to come and have a blood pressure screening, and also refer people to food pantry, diaper pantry, and access to care like a free or low-cost health clinic to those who doesn't have a health insurance. And along with the assistant people in the community, we are also working on the diabetes prevention program. This is the evidence-based national diabetes prevention program for adults with a pre-diabetes to prevent or delay type 2 diabetes. And it is a year-long program, and all of our CHW teams are certified coaches. And as of current, we are running one DPP classes started from January 31st in 2025 at the UNMC Community Collaborative. And we, along with the classes, we collaborate with Whispering Root for food demonstrations to provide our participants preparing a healthy meal for their family. Aside from the class, Lulu also translated participant guide and PowerPoint module in Burmese so that our participants have some written material to take home. And another program that we are working on is Health Coach for Hypertension Control. This is 8-week-long program for those with high blood pressure and caregiver who want to learn how to live healthier and manage their hypertension. And we have 3 CHW that certify hypertension coach, including myself, Lulu, and Alejandra. And we also provide free blood pressure screening at the community health fair event. And we are planning beginning of next year, like 2026, on February, we were going to start a hypertension control class to the community.
Due to the demand of our SNAP and Medicaid application assistants, 2 of our community health workers have become certified application counselors. That is Budo and Lulu. It's actually an extensive process. The department had to become a counselor designated organization. The CHWs had to complete a number of online training modules, and they had to pass required exams for each of those modules. And they have to recertify every year. But it has enabled them to help with these applications. And for 2025, we helped 225 people apply, 123 for Medicaid and 82 for SNAP. Community events, our community health workers are out in the community. They attended 19 community events, reached a total of 1,344 individuals. And among that number, 1,179 families were connected to resources. We have moved forward with an initiative with our clinic within this last year and a half, and we are doing internal referrals for our community health workers. So, and we have them staffing the clinic 3 times a week. Among that, 290 client referrals have come out of our clinic. 11 from our epidemiology program. We're starting to work more with general assistants in our building. So within the last 2 months, we've had 4 client referrals. Lead, we've had 9. Sanitation control, we've had 5. And WIC, we've had 35. So I think that shows that, you know, we're not so siloed and we are becoming more integrated within the department. Our navigation numbers for 2025, we've reached 1,121 families and connected them to resources. If you look at the pie chart, it kind of breaks it down into percentages, but obviously the Douglas County Health Department, that is where a majority of our referrals are coming from currently. And you might think, okay, how is all of this funded? We have been successful. We've had the opportunity to work under the Agriculture and Healthy Food Access for All grant. It is through the Chronic Disease Division at the DHHS. And all of our initiatives kind of fall under those 3 objectives: providing nutritional education opportunities. We are providing cooking demonstrations. We have already started a couple throughout the community, particularly focused on South Omaha with these last 2. We're improving chronic disease and maternal child outcomes through community education, screening, and policy strategies, really focusing in on those evidence-based programs such as DPP, the Diabetes Prevention Program, and the Health Coaching for Hypertension Control. And then lastly, we all hope that our initiatives increase opportunities for our residents of all ages to access healthy lifestyle choices. So appreciate the time to present to you today. And at this point, we'll take questions if you have any for me or our community health workers. Oh, sure. You bet. You mean physical addresses to you? Okay, sure. We can put those together and send those to you, or do you guys just want to speak on? Do you know where the Kenya Home Health is, the
It was
actual
like-
physical address?
Physical address is 33.
Go to the mic.
Oh, sorry. 3316 North 80th Street is North 80th. Yes. Of Nebraska, Omaha. Yes.
Kenya Home Care.
5530 North 61st Street.
Talk to the
Lulu, can you come to the?
5530 North 61st Street, Omaha, Nebraska 68104.
Thank you, Lulu.
Thank you.
The new Midtown WIC. It is located at. You want to tell her? Tell you. Okay.
It is 2801 South 80th Street, Omaha, Nebraska. 88th.
88.
Yes, 88th.
That's a new location. We just moved in there. You bet. Like, you mean as far as with our department? I mean, we are housed.
For individuals to come to these different locations, there seem to be, are they accessible by bus, public transportation?
Yes, public transportation, and we do have the opportunity in working with general assistance, so we have been able to provide bus passes for our clients. Yeah.
So the health department would be the main one, east of 42nd.
Yep. Yep. Yeah, we are lacking, as you probably noticed, with our, we used to have a community health worker at St. Martin de Porres, more on North Omaha, and with budget cuts and that position being vacated, we haven't been able to hire, but there has been a new community health worker that has been hired and placed at the Empowerment Center. So we're hoping to work a bit more collaboratively with that individual as well.
And I'm going to add too, we have been partnering with, good morning. I want to add that we've also been partnering with the Creighton Community, no, that's UNMC's, Creighton's Highlander in the child injury prevention. They are bringing on a community health worker that will be housed there at the Highlander. And then we also work with the Community Wellness Collaborative over at UNMC too. So within those two organizations, we didn't want to oversaturate. And right now, why not utilize our partners and work with them? So we're going to be integrating those individuals into kind of our education program as well too.
Yeah, and if you'd like, we can write down the physical addresses and send that out to get it. Okay, okay, perfect. Anything else?
Yeah, so you mentioned the SNAP plan, adding 2 people.
The SNAP demand. We just had 2 of our 4 CHWs go through the SNAP, the CAC, Certified Application Counselor Training. Is that what you're referring to?
I'm curious about did the SNAP demand happen before the recent shutdown, or was that increasing?
That was increasing before. Yeah. There is just, you not only have the communication, the language barriers, but it's also a lot of times applying online is the most efficient, fastest way to do that. And so if you don't know the language and you aren't familiar with computers, it's been a huge help for the community health worker to kind of come alongside the individual and help them to apply for those government benefits.
Yeah, I'm just curious, what is the certification person do? Is that hard or?
You know what? I guess, Budo, do you want to speak to the process that you have to go through?
It's okay. It is called a sister program. Like you are able to help people. How do I say legally? I don't know how to say
No, that's good. That's
yeah.
good. Legally,
even not like someone help, but it's like someone that know very well with the SNAP program help that person. I don't know. I explain well or not.
No, and you're certified, so that becomes, you are known on that application and helping that individual submit it. So she is verifying the information on the form for the client.
No, I get it.
Okay.
I'm just curious, is the form that hard that you need somebody certified, or is it you need to have a certification person, you have responsibility for certification? I'm just curious.
The form.
What's so significant about the certification program to certify and fill out that form?
The form has if you are not familiar, some of the question you might miss it or misinterpret it, something like that, because they have so many questions that people have to go through. So, but if you're familiar with the applications, you are fine. You don't need help. But some of the questions that people stuck or something like that, they will be able to help them get the clarification, something like that. So yeah.
You mentioned it's online, so the question is,
Sure.
Is the certification person the only way they get online, or say anybody?
No, if you know how to navigate, online, you can definitely go on and do that yourself. But we find that a lot of clients don't, and they do become overwhelmed sometimes at the questions, and particularly if they don't have the information. So, yeah, well, you have CACs at One World. I'm pretty sure they're at Charles Drew as well. You have to have that in order to help somebody apply for those benefits. It's almost like you're vouching for that individual, if that makes sense. Yeah.
One last question.
Sure.
The total number of certified health workers in the health department?
The total number of CAC is 2. Yeah, we've just had 2.
No, community health workers.
Total, we have 4 right now.
That are certified?
So no, we've got, within health promotion, we have 4 community health workers. There is one over in Jamin's section that has been assisting with the phone lines and some MCH work. And then I believe LED has 1 or 2 community health workers. But for the certified application counselor, we only have 2 individuals within the health department that are in that category. Does that?
No, I think the question was how many people that's what we do have. It felt like it was more than 40.
It was, yes, but with funding changes, we have been limited. And it been hesitant because ultimately I don't want to have to lay anybody off, and I want to make sure that we've got sustainable funding before we bring in someone into that position.
So it's 4 now. How many?
At
4
one,
now you have access to 2 more. The one you mentioned at Ames and on 30th and Grand. How many more do you have access to? So you have 4 in, access to 2 more.
it's hard to, I mean, we've got access to them. We've been working with them. We also have peer navigators within our overdose data to action grant that we work with that are just slightly different, working with a different population. But ultimately, there is a big group of CHWs, if that's the term that we're all giving to all the individuals within our community. There are a lot of them, and to try and pinpoint, and that is one of my goals in the upcoming year, hopefully. I say that hopefully, to bring together and have more of a collaborative approach with the CHWs in other organizations and how we can all work together better.
Thank you.
Let's move to item E and the community health and
I'll just get up now. I assume you found it.
Mm-hmm.
Okay. All right, well, good morning again. I feel like I've been up here a lot already. So here is our update on our Division of Community Health, Nutrition, and Clinical Services. And just a reminder of kind of the programs that are housed within my division is the STI Immunization Clinic, which houses STI services, adult childhood immunizations, COVID-19 vaccines. We also have our STI Prevention and Control Program, which does surveillance and then testing and outreach and education. We have our Women, Infant, and Children clinics, which has nutrition education, breastfeeding support, referrals, healthy foods, and formula. And then within our health promotion, you just heard our community health worker program. And then we also have our overdose prevention program. So within our immunization clinic, the big thing I wanted to highlight for you all, and I'm just pulling up numbers because I had her pull them this morning. We have had COVID and flu outreach clinics. So these are the upcoming ones that we've had. But so far, we've had 11 community clinics at this point in time this year, and we've provided 40 doses of flu and 36 doses of COVID at our community clinics. But I just wanted to showcase, these are our upcoming things. This is really what our immunization clinic has been working towards over the last couple months and moving forward. And you guys did hear Molly speak, was that last month, I believe, that she spoke on STI and immunization clinic. So our STI control office, we've had over 170 events in 2025, 230 plus thousand condoms distributed, roughly 7,000 people educated with 290 testing. In October alone, they had, I think, 120 or 130 individuals test in October through our outreach program, which is really great. We've had 113 vending machine tests with a 13% positivity rate. So as you can see, I just wanted to put kind of the graph of what our STI rates are looking like right now. I know syphilis and HIV is a little hard to see just because they're so small compared to chlamydia, gonorrhea, but we are seeing a downtick, which is nice. I don't think I've seen that in quite some time. As for a syphilis update, on our dashboard, you are able to see our infectious cases and our latent cases that we've had for each quarter. And then what I wanted to showcase on this next graph is the investigations by case status. So Our disease investigators do a lot of work when it comes to syphilis. Right now, they're primarily investigating syphilis cases or probable investigations, positive labs. And the green line is the total number of investigations, so that high number. But the red line on the bottom is the actual cases that end up being determined as cases. So any positive lab they have been reporting, but we've seen kind of a change in how we're doing our investigations and hoping to alleviate some of that burden on our disease investigators because they were to the point of burnout and it was getting pretty tough in the STI investigation space. But as you can see, the cases has remained steady at the bottom, but significantly lower than the number of investigations that we're doing. As with congenital syphilis, we've had 51 investigations this year with 7 cases. In 2024, we had less than 5. So we have seen an increase. However, looking at kind of how syphilis progresses, we saw a huge spike within latent cases. That's when it doesn't necessarily present, and women becoming pregnant during that. And now we're seeing kind of the aftermath. So there's kind of a curve effect to that when we're seeing these congenital syphilis cases come through. Some other STI updates, our at-home testing program. We've had 372 requests with 112 tests sent and 64 of those received back. We have been working, DHHS provided us some funding to do a media campaign for a syndemic approach looking at HIV, STIs, and hepatitis. And we've decided to go and collaborate with Lincoln Lancaster, Sarpy-CAS, and Three Rivers on this so that we can have sort of a regional approach, and it helps save money if you can pull together with your partners. So we're going to be launching that in January of 2026. They're currently working on the graphics now. As Natalie mentioned, our social determinants of health screener, it has been great having the community health workers actually housed within our clinic 3 days a week. And as she mentioned, we've had 290 client referrals in 2025. We are still, as Marley mentioned last month, PrEP has started, and we have roughly 30 clients started on HIV PrEP medication, which is the pre-exposure. So we are preventing folks from contracting HIV if they are exposed. But we've got roughly 30 clients started on that, and we have had the initial conversations with some local pharmacies to potentially look into obtaining 340B rebate dollars, which will help hopefully bring in some funding to assist with some of the things that we have going on in clinic. We are also working on Medicaid and medical billing within our clinic. We have had Medicaid approval, so as soon as we sit down with the finance team, we can figure out how the logistics of all of that works. We're working with our EHR to determine the best process for kind of going down that. And then our Ryan White funding, which is the early intervention services, we got notified that we will be continuing this for the upcoming year. So in the other side of our health promotion program, yeah.
Historically, our STIs have gone up, our testing, our outreach has gone up.
Yes.
We saw it was dropping, but is our outreach and testing still going up, or do we have a decrease in our testing?
So we have had a decrease in our outreach testing, we weren't necessarily, and I could have shown the numbers, I have it, but there was a drop after COVID, essentially. And even though our percent positive is still high, so we're still capturing the right individuals, I believe. Clinic numbers, I would have to pull, but we're just getting back to like pre-COVID numbers in our clinic. We're not quite there yet, but there was a huge initiative within the community prior to COVID, the Adolescent Health Project, that really encouraged 25 and under to get tested. They paid for all the testing, and I think that had a huge impact on now the change. You know, that funding stream isn't there anymore, so even a lot of our partners aren't providing as much testing as was previously done. However, I think access-wise, we still have all of it there. I mean, we've got the vending machines, our at-home test requests, so I hate guessing. I can provide the numbers to you all. I'll make sure I can send them out and let you all know. Yeah, yeah. Okay, so on the other side of the health promotion program, we have our overdose prevention. And with that, I actually talked to our CDC grant coordinators over yesterday afternoon. It was exciting to actually talk to them. They had been in the office for a few days now. So everything is moving forward with our year 3, and we are hiring a community health planner too for grant coordination. Sophia left us in the early part of October, I want to say, so we have been working to try and fill that position. We welcomed a temporary employee, Caden, to assist with outreach and education and work with Jennifer in providing naloxone harm reduction training within the community. And then I am happy to say that CDC Foundation picked us to provide a staff person. They will handle all of the HR, all the other logistics. They do all the hiring. They will pay the individual on their end, but we will have a linkage to care coordinator that will hopefully be starting in January to assist with some of our peer navigation and our peer support specialists within the overdose grant. As for numbers within overdose prevention, our fatal drug overdose deaths in Douglas County in 2023, we had 49. 2024, we had 38, and I will hopefully update you all on 2025 numbers once we get some data squared away. We have a new epi within the overdose program, so he has been working hard on understanding the data that we have, and we will get that information over to you. As for non-fatal drug overdoses in 2024, this was 48, and through DHHS in their data portal, if you will, they actually haven't updated the numbers since April, and that is 27 from January to April in 2025. So estimating, that would put us probably around, 60 to 70 maybe this year. Our overdose fatality review program. So we've had 5 case review meetings with 9 cases reviewed so far this year. We submitted our legislative report to DHHS and the Department of Behavioral Health, and we provided 7 recommendations from the OFR team. Yeah. I'm trying to think. I have this, and I should have looked at it better beforehand. I would say majority, like if you look at majority of those deaths, are most likely combination of drugs. Opioid has been involved in, I want to say, about 30% of those. For yes, the deaths, I would say, and I don't quote me on these, is about 30 to 50 age range and white male. But that's not taking into consideration the impact of populations, and that's just pure numbers. So I didn't go into a lot of detail on the community health worker program since you just heard from them, but I did want to share some pictures and just kind of listed out what programs they have been working on. The Newlands, diabetes prevention, navigation, hypertension, nutrition and cooking classes, certified application counselor. They really have been doing a lot of great work within our community. So our vending machines, it was, I believe, 1 year yesterday that we have had them, and we've had over 13,000 dispenses out of them. Items included sexual reproductive health products, harm reduction products, cabled gun locks, COVID test kits. Coming soon, we've been working with UNMC folks to have colorectal cancer screening kits within them. And we will also have some winter-specific items during this time frame, like some winter hats, socks, emergency blankets that we'll have available for folks. and just wanted to show kind of a breakdown of what we're looking at for the last year. So our health department one had over 4,000 dispenses. Washington Branch Library came in second at 3,600. American Dream, and then Sienna Francis and Nebraska Urban Indian. But you can see the breakdown of time frames is predominantly in the evening hours, which was what we suspected because people don't need stuff in 8 to 4:30. They need it after hours. So we're happy to be able to provide this and have things available for our community members 24/7. As was mentioned earlier, our WIC program, the Midtown WIC, has officially moved. We were excited to do that, and we went and did a final walkthrough of Center Mall on Monday morning. But their new location's over at 2801 South 88th Street, and I believe most folks, I think I got an open house invitation to everyone. So for monthly participation, our fiscal year 25 target was 14,713 participants a month. Our average for fiscal year 25 was over that, 14,879, which is a nice increase from even our fiscal year 24 participant average at 14,337. So our funding for fiscal year 26 has just started. We received just over $4 million. In fiscal year 25, so this is a decrease. I wanted to showcase the decrease that we have received from WIC. And even then, our final amended amount, there were some discussions with WIC and having to return some money, I believe. So we ultimately spent about $3.8 million in fiscal year 25. The cut for fiscal year 26, they were flat funded, so for me, it just came from DHS, yeah. They don't tell me that. I've asked. Correct. Yes. Thank you for, and typically in the past, we've always had a decent amount left over and returned to the state. So I think that was part of the discussions with last year's fiscal year of them changing our amounts. However, we have historically worked with our health department as a whole for interpretation. And this year, with our new interpretation system, it's going to cost us roughly $100,000 for interpretation items, which is something that we haven't had to account for in the past, just because it was kind of wrapped up as a whole within the department. But now we're doing it individually through each program. And so that was a big chunk of the cost that is eating out of what we have currently. So yes. All right, some other initiatives that we have going on. We've had our NEMS assessment. I know I've talked to you all about this before, but the 2024 NEMS report is posted online. Our NEMS P, which was the NEMS Perceptions, actually interviewed community members, and I received that final report early October, and we'll get that posted. But I've got a student that's coming on from UNMC that is going to be helping us kind of dig through the data. We'll be able to present on that, and I would love for her to come and present to you all on really just collaborating both of those NEMS assessments together and to showcase, okay, what are we going to do with this data now that it's available? The Nutrition Environment Measure Survey. So, and with this too, I have offered up with the student. We are collaborating with Extension Office, the REACH program, Sarpy-Cass Health Department, Pottawatomie County Health Department, and our WIC. There's a lot of action going on.
Sorry, I'm trying to get the mic side. Looks like this one's the only one that may be hot. So.
Okay.
you.
All right. So the other initiative has really been working to promote the Douglas County Health Department overall. We've been collaborating with our other local health departments to promote Public Health is for You. And this was an image. We were at what's called Baseball-Halloween over at Werner Park, and we collaborated with Sarpy-Cass Health Department and came up with kind of a dual logo so that when we are out in the community, we're promoting all of our local health departments and showcasing that we all work together and this is a combined effort. Some of the areas that we've been doing that is Baxter Arena. We have been putting a lot of information about Credible Mind, doing Public Health is for You, as well as at Werner Park. And as you can see, this was also the little logo that we came up with for Baseball-Halloween, that Spooktacular Health starts with you. So with Credible Mind, one of the things that I think is really great with this online resource tool is that we were able to update the resource page and link it to our main page, which was the picture I showed on here for food resources. So when the SNAP benefits were on pause, we were able to get this up quickly and have one central database that had all of the local food pantries within, and we were able to link it directly to our website. And so it fits and it helps us just kind of work together and have all of that there. So since our launch, we've had over 4,000 users. Our top online resources are how to handle back to school anxiety, 6 points of connection we all need, and how to be an ally to your LGBTQ child. The top local resources were the Community Mental Health Center, and it was the Spanish version, and Thrive Collaborative Care and 180 Reentry Assistance. We are, as we move forward with this online resource, we are collaborating with our Regional Health Council participants, working with Pottawatomie County and Sarpy-Cass to showcase how if we all have this resource, we're going to link together and have maybe a shared website. So we're trying to figure out costs that we can ultimately help save money and still have this resource available for our community members. So some of the division goals that we've had, like I had mentioned previously, clinic billing, continued collaboration between our programs, always looking for funding opportunities. I put DCHD public knowledge, but really just making sure individuals know about the health department and the work that we do. And then also within that kind of becomes the conference publication. So sending abstracts, best practices. So the progress we've made so far on some of these goals is we had Medicaid approved, so we can start looking into billing in that space. We're going to start looking into the 340B rebates and looking at some contracts with our local pharmacies. We've had CHWs integrated into multiple programs, as you saw in the previous presentation. Within our outreach programs, a lot of our outreach team members within different divisions have collaborated when they go out to different outreach events. But one of the big things that I think is really cool and has just started, the MOU actually went through the board today. So is working with Heal Omaha, and they provide street medicine to folks that are unhoused within our community. So we have worked with them and have a disease investigator that's been going out with them to help address any STI, HIV testing needs, education, follow-up care, any of those things. We've also worked with this same group that they have showed to our overdose fatality review team. So I'm excited to have a stronger collaboration with them. Staffing funding, as I mentioned, CDC Foundation is providing us an additional employee. We've applied for direct relief, which is a clinical support, and so I'm hoping to hear back in the next couple weeks to find out if they will be supporting. This could provide low cost or free immunizations to folks that are in that underinsured adults where currently VFA doesn't cover them. We've had our Baxter Werner Park partnerships, regional collaborations with Sarpy-Cass, Lincoln Lancaster, Three Rivers, and Pottawatomie. We've had abstracts submitted, and we have continued grant collaboration and coordination with our other local agencies. Thank you, and what questions do you have?
Does anybody have a sense, because I'm out of touch, with the Omaha Public Schools and the other schools, do they still have a nurse in a school clinic
that is on site?
I know that Charles Drew and One World still have their school clinics, but I don't know how often. Like, I know they share nurses between them. I just don't know what days, but I know there is still the school clinics.
But the high schools, do they still have a nurse-run clinic during school hours?
I know they're school-based health clinics, so I know, for instance, like, and I thought I saw Andrea on there. She might be able to answer what One World has, but I know like Drew has a physical presence in Northwest and and then they have time and schedules on how they work with everybody else. The old days of an actual nurse in there, I don't know.
Yeah.
But I do know they have access to school-based health clinics and things of that sort. I saw Andrea on there. She might be able to answer that a little better, but now I don't see her.
If you'd like, I can answer.
Go for
This is Andrea.
Yeah.
Yep. Both Charles Drew and One World have active clinics. One World has 5, soon to be 6, and school nurses in OPS are still school nurses, and provided at most schools there can also be not a nurse but a medical assistant that's at the schools.
Okay, appreciate it. Timely.
Mm-hmm.
I have a couple questions. Thank you for your report. It was thorough. For the STIs at the at-home testing, what's the turnaround time between the requests and sending out? Because I saw it was like 327 requests and then 112 or something like that had been sent out. So I'm just curious about that turnaround time.
So when they submit the online form, then our prevention specialist actually calls them, and if they're having symptoms, we just tell them to come into clinic. So that may be why they don't get a test result or a test kit in the mail. So we may have them come into clinic. If you have symptoms, I want to get you treated as fast as possible.
Okay.
So that is sort of the discrepancy. I would say originally we had the Stanley Cup program for doing some test validations for our at-home test kits. That created a huge spike in requests when we did that, and we had one person working on this, and we had like 250 requests in one evening. So the bulk of them came through at that time, so her trying to follow up with them. We used to have a short turnaround, but I would say now there's probably a couple days until someone is able to call. But if we call, it's to get that initial information and then either refer them into our clinic or we mail the kit.
And then once you have the call, does the kit get mailed out that same day, or is it still okay? It might just be easier for your report out just to kind of show, because it seems like they're not getting their kits right away. But if they're having they come into the clinic, that would just be nice to
I'll
see.
put that in next time.
And then I have just my last question. The CDC Foundation, how they're funding that staff member, and they're supposed to start maybe possibly in January.
I'm hoping.
Do you know how long they plan to be housed at the health department?
So it's a yearly grant that, so we applied, and then CDC Foundation picks certain local agencies that are funded by Overdose Data to Action at CDC and fund that, but you have to reapply each year for that individual to be staffed at your health department.
Okay.
The state has had someone funded by CDC Foundation for the last 4 or 5 years. So that's my glimmer of hope that it has been a reoccurring thing that hopefully we'll be able to keep this person for a while.
And that your application, the health department's application, is different from the state's, right?
Yes.
So they get their,
Yep.
okay.
Yep.
Okay, thank you.
Yeah. Morning.
Question in regards to the colon rectal cancer that you mentioned. You're going to be providing those tests as well. What is the process with that? Once somebody provides that sample, does it come to Douglas County, and are you referring them to their primary doctor? Can you tell us how that's going to work?
So we actually aren't involved much with that one. We are working with UNMC's research team, Dr. JY over there. She has a bunch of kits, so they're actually, I am just supplying the portal for them to be dispensed. But once they, Dr. King, you want to go ahead and?
I'm a part of that project. So the kits, once they come in, they go to an outsourced clinic, probably through the Great Plains Colon Task Force, and then they are tested there. And from there, the letter goes out to the person so that they can know what the status is. If it is a positive, then typically a Charles Drew staff member will call them and then try to get them connected to see the next steps of either getting a colonoscopy and having access to possibly resources that could pay for the colonoscopy depending on their income and eligibility status. And then they can go ahead and do that. But they would basically come in through Charles Drew and either become a new patient there if they don't have a medical home, or would help them to get access to that resources to get their colonoscopy if they have a positive result.
Sounds great. Thank you.
Putting an age limit on that, just since it's recommended for 45 and up now, are they?
I believe we had talked about, like, there's a survey.
Okay.
Awesome. We'll do a survey on the machine that asks them questions, and it will pop up, like, if you're not within those recommended guidelines, a thing will pop up, but if you have, for whatever reason, need to get one, it will still pop out. So we've kind of worked through some of that. We're in the very early stages, but we're hoping to get this out. And I know there's, I say, a limited number of screening kits, so we may only do this at 1 or 2 of the machines that we know folks that access those machines aren't just taking stuff to take stuff out of them, so that they're actually getting utilized and sent back.
Awesome. And then with that, I think you said it was around like 13% positivity rate with the vending machine STI tests. So is there any opportunity for like a test for cure, or are you recommending that when they're getting treated, or what's the process there?
That would be with the at home.
Mm-hmm.
You know, I will say if they are positive, then we have them come into our clinic, and our clinic does typically do a full visit when they do treatment, especially on our outreach folks. So, and that would be considered one of our outreach individuals. Cool. Thank you.
Good morning. Thank you. This is Jennifer Morgan, and Workforce Development Program Director, and here to talk to you about all of the stuff we've got going on in DCHD's workforce. If I can make this work. Been up here in front of you a couple of times and have shared kind of our goals for the workforce development team and the things that we're working on. They align really nicely with our 4 values that DCHD has worked over the last couple of years to really cultivate within our culture. This work is funded through the CDC Public Health Infrastructure Grant. We, as of December 1st, will start year 4 of that 5-year grant. And we've had about 66% of our grant milestones complete over the last 3 years. Some of the key projects that have hit under this is the accreditation that we received this year, the strategic plan that we've implemented, and then performance management, which is a big one we've been working on this summer and fall, which I'll talk about a little bit more as we go forward. One of the indicators of employee engagement and satisfaction over time is definitely our retention rates. We are down a little bit from 2024, but that's simply because we have about 4 to 5 open positions right now that we're working through and actively hiring. I do see that number will be coming up as we get those positions filled in the next few months. Performance management. I'm actually really excited to talk about this approach that we're taking to how we're looking at our work that all of the teams across the department are doing. Performance management is really this very disciplined approach to looking at what success means and then being very transparent in our numbers that we're capturing and that communication thereof. Really what I'd like you to focus on is the programmatic performance measures that are really looking and engaging what our teams across the department are doing. And there are three questions that gathering this data is looking to answer, and that's how much did we do, how well did we do it, and is anyone better off? And so as we're looking at all the different programs across DCHD, we're asking those questions, and those are the metrics and the numbers that we're capturing data on. This is an example of our system that we're using, that we've implemented, and our front runner of our food safety and compliance team. And this is just some of their measures that they're capturing data on and going to be sharing with the entire department as we move forward. So you can kind of see the different things that they're looking to capture. And each one of our sections has done a similar look at their work and has a similar dashboard and place to capture that data. When we're looking across the entire department, as I said, each one of the sections went in and analyzed all of their work, looked for that data that they want to capture, and we have 314 programmatic performance measures that everybody's capturing information on and going to be utilizing to really drive our quality improvement processes. So that's what all of this data is looking to do, is to say, how are we doing and how can we get better to do more to serve our community? One of the kind of next steps of the performance management system is going to be what Dr. Hughes likes to call the health stat meetings. And so what we're going to do is once a year, each one of the sections is going to present on their data, what they're doing for quality improvement, and how they're going to kind of go forward with running their programs, what they need, what their roadblocks are, what their successes are. And this meeting will be a pretty formulaic one to look at what we're all doing, that Dr. Hughes will be running that once a month. So I'm switching gears on you a little bit here and going into our PH wins. So last fall in 2024, the De Beaumont Foundation actually ran a national survey for all health departments across the U.S. to look at engagement, satisfaction, training needs, lots of different aspects of how the public health workforce is doing. DCHD had an 81% response rate, which was excellent and gigantic, and very pleased about that. So we have some really good data. You can see here in this chart, we do have some data from 2021, which was the first time we had taken it, and then 2024. The job satisfaction had a nice increase in 2024, as did the organizational satisfaction. You can kind of see how those lay out with those numbers. One of the other questions in the PH Wins survey was mental health. 79% of DCHD employees rated their mental health as excellent, very good, or good, which is a strong number. It is a little bit off of the national number. When you look across the whole U.S., it was about 82% of public health employees rate their mental health in those categories. And the data, of course, on the right here is all DCHD data. As we go through with PH Wins, there are training needs were assessed. And in doing this, the survey looked at not only what people self-identified as what they wanted to be trained, but also how relevant that training was to their job, and came up with a variety of training needs. And there's actually about 15 different categories when you look at the full data of this, but I just put in the top 5 here. Looking specifically at the budget and finance policy engagement. And so that's really the external policy engagement, and then systems and strategic thinking. When we look at that, all of those pieces, those are the things that we'll be focusing in on in our learning program as we go into 2026. So when we look at the PH wins, it was every 3 years. We actually decided that we needed to have more information at a more regular basis to understand kind of what the health of the workforce is doing. So in October, we launched a 90-day pulse survey. And this is 15 questions, so a really quick survey in the last 90 days. And I'll show you some of the different areas that we were looking at. But it was supposed to be a really quick kind of pulse of what the teams are feeling and how they're seeing different aspects of their job. In this first launch, we had an 80% response rate, which is huge. And what that indicates to me is the teams are trusting and they want to be engaged and have some really great ideas of how they want to be involved in where we're moving with the department. I only took a section of our results here. Yes, sir. Oh, sorry. Did you have a question, King? Dr. King? Oh, sorry about that. All right. This is just a section of the questions that were asked, both on the very high end, the categories that we did really well and the categories where we need to put some attention to. The full results of both the PH wins and the pulse survey have been published internally to all to the whole department, and I believe Dr. Hughes is going to be sending it to you all as well. So when we look at this, the different categories, the high end is that our staff really knows and appreciates the work that they're doing. Some of the areas that we have to work on are communications, quality improvement, and that psychological safety. We also had, in that survey, we had an open, please give additional comments as our last question. And we had 30 individuals that responded with comments. There was a wide range, but really it was definitely a desire for more transparency, open communication, and a real drive for innovation across the department. You can see what a few of those have said there, but I think we've got some good actions that will be driving what we do before the next survey. So the first that we did was we went ahead and published all of these results internally. We actually have seen both Dr. Hughes and Justin starting to increase that level of communication, one-on-ones, those sorts of things. We also are putting together a You Said We Did dashboard. So as we kind of look back at all these various surveys that we've done, I want to start cataloging all the different things that we have actually accomplished, because there's a lot of things that the department has accomplished. And so I'm really excited about starting that dashboard. We'll also launch the next survey in January, again, so we can start looking at that over time, and that's where the real power of these pulse surveys are. And so to quickly kind of wrap up, because I know we've got time going on here, these are kind of the areas that we're going to continue to focus on in workforce development. We've got the Pulse Survey Action Plan, Workforce Development, and PMQI Plan, which we're hoping to get out sometime in January. 2026 update to our strategic plan, our training plan, and a potential for a learning management system, as well as a leadership development training that all of our leadership team will be going through in 2026. So that is what I have for you. Any questions? I went through it very fast, so if there's something specific, please.
How often are you going to start doing those pulse surveys?
Every 90 days, so once a quarter.
Can you start adding that like a report that the board gets in that file? I'd just be curious just to see that to get
Yep.
Okay.
We'll actually put it into Achieve It, so much like we're reporting our strategic plan.
Uh-huh.
We'll put it in Achieve It, so I'll just add that into the board
Google
meeting
thing. Okay.
report that we send every month.
Got it. Yeah, I appreciate that. Anybody else?
I have a couple questions.
Yes, ma'am.
Also, thanks for that, President, because I was also interested in seeing that regularly, the report out. For the plan to address those training needs,
Yeah.
can you go back to that slide?
To this one?
No, the one that you showed the training needs.
Oh, from PH-WINS. Oops.
Yeah, yep. Go back. Yes. So how are you planning to address those training needs? Like, what's going to be the actual process to ensure that those needs get met?
So we are looking at, well, let's back up a second. There's actually a lot of already built training kind of in the public health realm that address these needs from various universities, other foundations like the de Beaumont Foundation and whatnot. So we have access to all of that training. Really what we need is to be able to catalog that and make it easy for consumption by our teams. And that's what the learning management system will do, is be able to track, push out, say, assign individuals training, things like that. And so that's what we're looking to set up, so that way we've got a way of being able to manage all of those trainings that are out there. So we actually already have, I want to say, about 71 hours of training modules identified from all of these various places that would hit these needs as well as all of the others. And the public health competencies is what it's really driven off of. So we have a catalog of all of that that's available to all staff. That learning management system is just going to help us do it in a little bit more regular and prescribed method.
Okay, is there going to be an evaluation that follows these trainings to ensure that they actually have achieved what they needed?
Some of them do have that built in, some of them don't. We also would like to do, I'd also like to do a series of in-person trainings that we would do in-house, where we could do some of that work and model it in the adult education methodologies.
Okay, and those that don't have the evaluations built in, are you planning to build those in for your own internal data
Yes.
collection?
Yes, for the own
Okay.
internal ones, we will.
And then just to make sure I understand this slide correctly, 2024, those were the needs, but in the bar graph, those are the 2025 needs?
So it's all based on the PH-WINS, and it was 2024, and this is only reported every 3 years.
Okay.
But we just got the data here this summer, so we're building it into the plan for 2026.
Okay. And then if you could go to the slide around the, where it had the cautions and the concerns.
Before you go, let me ask one question on
Oh,
that.
yes, sir.
So how should I interpret, let's say like in community engagement,
Yeah.
2001, it's 54%, 2004 is 56. Should I engage that they want,
more?
that the staff wants more community engaged training on how to do it, and they don't know how to do it? How should I interpret that?
So what that's saying is actually in 2024, the team deemed that they didn't need as much community engagement training. But if you look at
46% needed in 24, 54 needed in 21.
Yeah, this one's backwards, and I apologize about
Okay.
that.
I
So
think
the
it's the other
orange
way
is the
around.
2024 response. I'm sorry, Dr. King.
That's the other way around, right?
Yeah.
So you're saying 54% said they do not need community engagement?
Nope, they said in 2021 in the blue, they did want 54% of them did want that training. In 2024, only 46% of the staff said, I want that kind of training.
Okay, so then now I'm confused. So then what you're saying the needs are on the 2024 identified top needs, shouldn't community engagement be over there instead of these other three that are listed on the right side of the slide?
So if you look at 2024, the top one is 66% of this budget and finance. Policy engagement is 49. And then I guess change management and strategic think are both 47%. And the community engagement is 46.
Are we looking at 2024 or are we looking at what's the orange?
2024 is the orange.
Oh, I can't see that from here.
I apologize. It's
but
very
all the
small.
other slides have been the other way around,
Yeah.
so that's
Yes, ma'am. It is confusing.
a mistake.
So I'm just trying to read under this, and I'd be curious just to see this. For 24, I'm wondering if the policy engagement piece is a result of the current environment, or what they want to do. Somebody just note that. I don't know what it is, but I'm just trying to figure out what that is. So do they want to be more involved in advocacy, lobbying? Do they want to see more result? Because all of that is a different thing.
Mm-hmm.
So the 2024 was actually administered kind of before some of the political it went down last fall. So I actually think it's because Dr. Hughes and other folks within the department do talk a lot about our legislative system and what we're seeing and how we're engaging, how NALED's engaging and those sorts of things. So I think it's an organic, hey, I want to understand more how this process works, how we lobby, how we engage, advocate, when we're talking about the work that we're doing and talking with policymakers. So that's where I think that actually comes from.
Okay.
I have another question.
Yes, ma'am.
Is it cool to move on? Okay. For the slide with the caution and the concerns, can you go to that?
Caution and concern.
You had green, yellow, red.
Oh, this one.
Yes. So it's concerning actually to see that last one that staff feel they have experienced, I can't see that. I have experienced that I can question how things are done at Douglas County Health Department without a fear of negative consequences.
Yes, ma'am.
Just noting this for the record, that is concerning, for real. And then can you go to the slide where you talked about the immediate and intermediate actions? How are these aligned with those yellow and red pieces? Because you giving me this list is not telling me how you are specifically addressing those caution areas and specifically addressing that concern area with respect to people feeling like they're going to get negative consequences if they speak up.
Yes, ma'am. So we actually just got this data shared with the management staff last week. So we're working through what that plan looks like, but we will definitely get you a detailed plan of how we're going to look at particularly that one, because I would agree it's very concerning.
So what you're basically telling me is that you have no immediate or intermediate actions on this slide that address that concern.
Correct. We're still talking about that plan. Yes, ma'am.
Okay, and so what on this slide is addressing the yellow pieces, the yellow ones on?
So this slide really is looking at the communication piece and the transparency piece, which are this one here and then this one here. So really, this is really.
Can you give me the number, because I can't see that cursor going back and
Oh,
forth.
I apologize. Number 8, the departmental internal communications. I have experienced communication at DCHD as timely and useful for my role.
So only number 8 out of all of those 4 is.
That's where we've started. Yes, ma'am.
Okay. I think we need to just make sure we're seeing at our next meeting what is being done for each of the yellow and each of the orange, because I mean, I understand that you just had this pulse survey check, but when did it close? October 29th?
October 29th.
And today is November 18th?
Correct. Yes, ma'am.
I think that there's enough time to be able to address more than one of those. So I'd be interested in making sure that we present at the board next month how each of those yellow and specifically number 11 is going to be addressed.
Yes, ma'am. We sure can.
Thank you.
Definitely would second that. I'm concerned about that as well. Were there any comments that led you to why people felt that way, or any other indication?
So the comments, and that's, Dr. King, to your point, that's where a lot of these actions came out of, was the concerns that were raised in the comments, which did talk a lot about communication, transparency, building trust. Those were a lot of what the comments were talking about. And so kind of hitting it from that angle and that foundation of building psychological safety is building trust, which oftentimes does come back to that communication.
Are the comments under each of those items, or is there a separate comment section in this survey to where, because I'm trying to figure out if you can link the comments to the items?
So not necessarily, it's just a catch-all at the end,
Okay.
open-ended at 15.
Okay.
Thank you. I just want to say and congratulate the department for doing this survey and looking at the data.
Thank you.
You can't fix something if you don't know it's broke. So the data will really help the team and the leadership hone in on those things that can be strengthened. So, and I understand that this is a point in time. And so it'll be nice to see how this data changes as you implement the action plans and the training, et cetera, within the organization. So,
And then over time.
Yep, absolutely over time. So, a lot of kudos. I understand it can be scary sometimes to do these surveys within a team because you aren't sure what you get back. But on the other hand, I'm hoping that these surveys develop some trust within the team that we are asking and that they can see the results improve over time.
Absolutely.
Yes, ma'am. Thank you.
Thank you.
Appreciate it.
Okay, my comments are brief this morning, so hopefully we get you out of here and get into that executive session quickly. So I wanted to, first of all, start out by commending our food safety and compliance team. Last week, they got a request to do a pretty comprehensive audit of area grocery stores in regard to a formula that had been recalled due to infant botulism. There have been about 23 cases, I believe, or at least 23 hospitalized infants in the United States due to the connection to this particular formula. And it came down during the holiday that occurred last week, and our food safety and compliance team was able to go out the next morning and really start to completely look at each of those stores that DHHS had asked us to look at, and we were able to hit all 19 of those locations that same day. So we were able to complete that audit for DHHS pretty quickly and to also educate those stores on assuring that those products are not on the shelves. It's a somewhat uncommon formula product. It's not one of the main big brands like Similac or Enfamil that you would see. And so I guess that's a benefit that it keeps it somewhat smaller, but I just wanted to commend them for that hard work. I also wanted to commend our sanitation crew. Yesterday, the City Council read on third reading our pool ordinance, and that was passed. So I wanted to commend their hard work and collaboration to get that pool ordinance complete and updated. There is also a livestock ordinance that is before the City Council. That one has actually been held over to mid-December as we are meeting with some community partners, including the city, and doing some amendments to that ordinance. So more to come on that. I think that vote may be coming the day before this meeting next month. So hopefully I'll be able to update you there. We have a new dashboard. Our COVID dashboard is actually being updated, and that'll be going live on Friday. And we continue to work on some other dashboards that hopefully we will be getting up in the next few months regarding different health indicators within our community. Also wanted to just give you a quick measles update, since that continues to be something that's in the news, and it is something that we continue to track. There was a recent measles exposure at Kansas City International Airport. I'd mentioned that just because it's pretty close and our population may utilize that airport a fair amount. There have been no cases here, just to be very clear, but we do continue to monitor that. We do continue to answer questions from our providers and the public about that. So if anything develops, of course, we will let you know, but so far, nothing that we need to be concerned about there. And then I was going to talk about the colorectal screening kits that are going into our vending machine, but Leah did a good job of covering that, so I won't hit you with that again. And that is really all of the updates that I have for this setting this morning, if you have any questions for me.
Dr. Hughes, let me ask, so would that be, how many ordinances have you already did this year? 2, and this would possibly be 3.
I'm sorry, can you
How
speak
many
up?
ordinances have you
Oh,
already?
ordinances,
I know
yes.
2 that I know of, so this is
Yes.
2 and possibly this one would be 3.
Correct, that is
Okay.
correct. And then we'll have more next year.
So is this just conversation with Pete and you all picking the spots now? Okay.
Yes.
Okay. How many, you just going through the book then and going to make it
We
rounds?
are. A number of our ordinances are fairly out of date with recommendations and standards, and so that is something that Eric was charged with pretty much right away when he came to us, and he has done a great job of working with his teams to push those things forward. I will say some of these ordinances are things that our teams have actually been writing or working on the rewrites for a couple of years at least, and so the food ordinance, which passed, was it last month? The month before, last month, that was one that was in the works for quite some time, and we were finally able to get it to a place with city and county attorneys where it answered all of the questions, it did all of the things that it needed to do, and we were finally able to present that and get that through. So yep, that's exactly right. We're kind of just going through all of the ordinances that pertain to public health and making sure that they're up to date and aligned with current standards.
Has the monthly meeting with the mayor kind of helped you flow this a little better?
A little bit. So the last 2 meetings have just been quick phone meetings, although the one phone meeting I was in the building, so I just went ahead and stopped in. But those have been pretty quick, brief meetings, but certainly are helpful to get his perspective on what's going on, and if we're needing additional city support to work on that as well. They've been very productive meetings. Thank you.
Is he getting comfortable on how to use you for some of the initiatives? You all, okay.
I think so, yes.
All right, okay.
I have a
Has
question.
the damage, has the damage from the water leak been resolved?
Partially. So that's a really good question. So as you know, I sent you all the pictures from our recent water leak in the basement. It was a pretty significant pipe burst that we experienced in our call center. It took out, I would say, about 75% of that room. We are still looking at repairs for that room. So the pipe itself has been fixed. They replaced a pretty extensive piece of pipe that goes up to our bathrooms. So that at least has been repaired. However, the room itself will be requiring new drywall, new paint, new carpet, things like that. And of course, we'll have to work on replacing some of the technology that was in that room. A lot of it was from early in the pandemic, so already maybe outdated a little bit. So I guess it's an opportunity to update some of that. However, we want to make sure that that space is being utilized in the most effective way possible for the department. So we're currently in conversations with Public Properties to plan for how we want to use that space going forward, and also keeping the capacity for our call center.
So who owns the building?
The county owns the building.
The county owns the building?
Mhm.
Okay. And is there a mechanism? Because I know there have been other issues structurally with that building, and there are other entities housed in there. Is there a provision for that building to kind of be inspected on a yearly basis to maybe look at preventing some of these issues?
I don't know what their inspection process looks like, but I will say that they're in our building a fair amount. They know the building pretty well. I think there were probably some infrastructure, I wouldn't say replacements, but renovations that needed to happen a number of years ago that didn't happen. And so we're seeing the ramifications of that now with things like HVAC and pipes. So we are, Public Properties is well aware of the issues that our building has, and they've been working with us to resolve them one by one. Dr. King, did you have one?
Yes. What's your update for the foundation startup?
Yes, thank you. So that is going great. We just in the last week got the big stack of paperwork that we have to complete, that that the attorneys at Baird Holm have started preparing. So those will be going in at the end of the week, and then that batch of paper is what goes to the state for the state portion of this. So it's moving along.
You said it's going into, where are these papers going? You said they're going in somewhere, but where?
Right. So we have a portion to complete of those papers. Those will go back to Baird Holm, to our attorneys at Baird Holm that are doing this process with us, and then they send them to the state. And the state is the one that sets up basically that, recognizes that 501c3 from a state level.
Okay. And has your attorneys told you about what's that turnaround time for the state to review and get back to you?
I've asked that question, and they said it just varies. It depends on how much they have in front of them. It can be a couple months. It can be 6 months. They really didn't have a really narrow projection to give us on that. It completely depends on what's going on with the state.
Okay. And what's your attorney's plans to follow up just consistently to get an update or status of where the paperwork is?
Sure. So my plan with that is that I'll be contacting the attorneys every month to see where that is. And so they will also be checking to see the status of that, and then I will make sure that we're also reporting on that here.
Okay. I want to stress the importance of this getting started, because I know the governor has already stated that he is coming for those tobacco settlement dollars again next year.
Yeah.
For that fiscal year. And there's a number of folks, including my own institution, that is at threat of this again. And so I just want to stress the importance of us really pushing to get this where it needs to be ahead of that.
Thanks. I really appreciate that comment. And to that end, also, I've been meeting one-on-one with all of our Omaha senators just to really have those conversations about the importance of those tobacco settlement funds to health in Nebraska, not even just to Douglas County Health Department, but to all of us who depend on that for infrastructure needs and other things.
Absolutely. That's good to hear. Yeah. It is going to affect the entire state. Yeah. And I don't know what the governor knows about that or if he cares, but I think that that's important that you're doing that. So thank you.
Yeah, absolutely. Any other questions? All right, thank you.
No, I just think you reiterate that the doctor's statement is an understatement. So, any report questions from board members?
I don't have a question, but I have a request. Could the department reports and updates, would you please provide the name of who submitted that report? Thanks.
I'm assuming those slides will be sent to us too that we presented today. Okay. All right, so with that, we do we'll note the next board meeting, which is December 17th, and we do need an executive session for two matters. One is finance, the other is personnel, so we'll go in there for two matters. Hopefully, we shouldn't be in there, hopefully, any longer than 20 minutes, and we won't take any action when we come back out. So is there a motion to go into executive session for finance and personnel matters? Motion by Weiss, second. Second by Wilkin. Roll call.
Yes.
Yes.
Jones?
Yes.
Rogers?
Yes.
Wilkin?
Yes.
Yes.
for you.